Welcome everyone. I'm just going to pause for a couple of moments whilst I see people still joining us for the final session of this symposium. Thank you so much to all of you for joining us again. This has been an amazing meeting, I think, bringing together people from around the world for the first time to discuss neuroblastoma, to discuss treatments, to discuss the toxicities of therapy. And I really hope that for all of you who've been able to participate, that you've found something useful from it, that you've been able to ask the questions you wanted to ask, and hopefully even had the answers you wanted to have. So I'm just going to say a few words at this point, because really I want to introduce Pat Tullingen, who is going to take over and talk to some survivors of neuroblastoma, because I think it's really important that actually at some point in this meeting we hear from the individual patients who've been affected by this disease, and we hear from them. So Pat is the president of the Children's Neuroblastoma Cancer Foundation, which is obviously one of the host charities for this meeting. Her son Nick was diagnosed with neuroblastoma 15 years ago, and unfortunately relapsed and died from his disease at the age of 10 years. And shortly after that, she set up this charity, Children's Neuroblastoma Cancer Foundation. And really, she has led the way in creating the first parent meeting to bring together families to discuss neuroblastoma. And I think, you know, from what started in Chicago, this is now a global phenomenon and now a global meeting that has grown out of what started then. And so I'm delighted to introduce and to hand over now to Pat to talk to two survivors of neuroblastoma. Pat, over to you.
Hello, everyone. Thank you, Dr. Morgenstern. I'd like to welcome everyone to our final presentation on the symposium. Every year at the CNCF conference, every year at our conference, we end it by having one or two neuroblastoma survivors tell their story. We know these past 2 days have been filled with so much medical and scientific information, you will need days or weeks to process it all. We like to close our sessions with the survivor stories to allow you the emotional freedom to hear from those who have come such a long way since their diagnosis, and to provide that ray of hope you can hold on to in your hearts. Our two survivors are Emily from Ohio and Althea from California. Both have spoken at our conferences before, and Althea spoke at the ANR meeting in San Francisco in 2018. I will let them tell their stories through the videos that we are about to present. They will both be joining us live afterward to answer any questions you might have. Enjoy their stories. Thank you.
My name is Emily Ware. I am 20 years old. I was diagnosed with neuroblastoma cancer in July of 2003 when I was only 2 years old. Neuroblastoma is a solid tumor cancer of the nervous system. My initial tumor grew out of my right adrenal gland and attached to my right kidney, liver, and wrapped around all 5 of my main arteries. It was 5.5 by 6.5 inches. I had the first of 5 ports placed and started high-dose aggressive chemo, in which I spent 25 days a month inpatient for 6 months. Then, after shrinking the tumor, I had a 7-hour surgery at Children's in Cincinnati, and 95% of the tumor was removed. Then I went to Columbus Children's on Christmas Day, 2003 for a stem cell transplant. This was 30 days in one room. After transplant, I had 3 weeks of radiation, which I was sedated every day, finishing with 6 months of the magic bullet, a monoclonal antibody infused by IV for a week inpatient every month. Then I was in remission for 10 months and went for routine scans in July 2005 and relapsed with a 4-inch tumor around my aorta behind my heart. So then we started a low-dose outpatient chemo, in which I got chemo every day for 10 days on with a 2-week break for 24 months. I had open heart surgery at Columbus Children's 3 days before Christmas 2005. Then I had 3 weeks radiation again in April 2006. I finished my 24 months of chemo in June 2007 and was announced NED, no evidence of disease. I was without treatment for 2.5 years and was able to grow hair, attend school, church functions, play softball, and was loving life. Then in January 2010, I was complaining of back pain and headaches daily. So my mom told my doctor and he ordered scans. I relapsed again. This time a tumor grew out of a gland of my neck and was wrapped around my jugular vein and my spinal cord. This is why I had back pain and headaches. This time I had my 18th surgery for my 5th port to start chemo immediately, in which I got chemo 5 days a week with 1 week on and 2 weeks off until December 2010. I was supposed to have major open heart surgery the day before Easter that year, but thanks to my treatment and oncology team, it had shrank so small I didn't need the surgery. So I then started 3 weeks of radiation every day, followed by 5 days of chemo. Now I have been in remission for almost 10 years. December 17th of 2020, I will be 10 years cancer-free. I now have lots of issues from the aggressive treatment I endured as a child, which include hearing loss, osteoporosis, scoliosis, chronic pain, chronic fatigue, endocrine issues, hormone imbalances, and early menopause, just to name a few. Every day for me is something different as new challenges and issues are constantly presenting themselves. Yet I still push through using my voice to help raise awareness and make a difference for those who are fighting this ugly battle I have had to walk through 3 times. My wish is that one day, kids who are like me won't have to deal with so many side effects from the aggressive treatment that is their only fighting chance of beating this horrible disease. I hope hearing my story today will bring light to this horrible disease for research and hope for families, as I know just how much it can mean to see a glimmer of hope in a time that feels so dark and hopeless. Thank you so very much for letting me share my story with you today.
Hi everyone, my name is Althea Hansel and I am a second year MD PhD student at the University of California, San Diego School of Medicine. I'm also a stage 4 neuroblastoma survivor. I had the privilege of speaking at the CNCF Parent Education Conference back in 2016, and it is an absolute honor to get to team up again with CNCF and Solving Kids Cancer to speak with you all today. In particular, I would really like to thank Pat for inviting me back. I remember very little about my actual treatment for neuroblastoma. I was diagnosed over 20 years ago, shortly after my 3rd birthday, and I quickly began treatment at the Children's Hospital of Philadelphia. While I was there, I was treated by Dr. Yael Moshe, who some of you may have heard from yesterday, and Dr. John Maris. Given my high-risk disease, I received an intensive course of therapy over the next year, including several rounds of chemotherapy, surgery, double stem cell transplant, and localized radiation. Since I completed my treatment, I've been cured for almost 2 decades and counting. I'm sure that many of you are intimately familiar with the realities of neuroblastoma treatment and their long-term side effects. I personally have been blessed to have remained relatively healthy, plus or minus a couple non-essential organs. While being profoundly hard of hearing has certainly made school via Zoom very difficult, my disability has really not significantly hindered my ability to move through the world. The real story I want to talk about, though, is my survivorship. I've wanted to become a doctor for as long as I can remember, but I also feel a deep love for science. After being treated and followed for many years by Dr. Moshe, she invited me to do research for a summer in her neuroblastoma laboratory back in 2013. As a member of her lab, I worked on testing some of the ALK inhibitors she likely talked about yesterday. And this experience introduced me to my love of cancer research that I continue to carry to this day. After another summer in Dr. Moshe's lab, I spent 2 summers doing further neuroblastoma research with Dr. Clay Gustafson at UCSF, as well as 1 summer with Dr. Bill Weiss. Their incredible mentorship, as well as the support of my friends and family, allowed me to achieve my lifelong dream of going to medical school, allowing me to use my life and opportunities that I've been given to help other children with neuroblastoma who have come after me. Looking to the future, I will begin my PhD training next fall, and I will be completing my PhD work at the Scripps Research Institute. After 3 to 4 years, I will return to medical school, and then I will finish the remaining 2 years of my MD degree. After graduation, I hope to pursue residency and fellowship training, and eventually I would like to work with other pediatric cancer patients and survivors. Like when I spoke 4 years ago, Pat asked me to use this time to give the parents in the audience hope. I failed to mention this earlier, but over the course of my treatment, I was admitted to the ICU twice. I recently learned that during my second visit, Dr. Desai told my parents that I was going to die. Yet, my parents and my twin sister refused to give up hope for me, and here I stand before you today. I am privileged to have not only experienced the realities of neuroblastoma as both a patient and a survivor, but also to have researched new treatments for the disease and met incredible patients in the clinics. I'm inspired not just by my own history, but even more so by the dedication of my mentors, the bravery of the patients I've seen, and the parents who continue to fight for them every day. I never fully realized what strength and resiliency looked like until seeing neuroblastoma patients and families for myself. I don't know the fear and the pain and the heartbreak of seeing your child diagnosed with neuroblastoma or eventually losing them. What I do see is I see the perseverance of people like Pat, who continue fighting for other children and their families. This is where I draw a huge amount of my own motivation and grit, inspired to use the tools and opportunities that I have to pay them forward to the next generation of neuroblastoma patients and families. I lean heavily on this inspiration, especially when my coursework gets difficult and it is hard to see the light at the end of the tunnel. I am truly humbled by the connection I share with other children with neuroblastoma, past, present, and future. I dream of working with them in the clinic. I dream of continuing to work alongside the incredible researchers you've already heard from to find more effective and less toxic treatments than those I received 2 decades ago. Together, we can continue to make bright futures for children with neuroblastoma and their families. I want to thank you all for your inspiration and for your perseverance. Thank you for your time, and I look forward to speaking to you live.
Wow. I tried not to cry. I really did try not to cry. But I just wanted to thank both of you very, very much for sharing your journey with everyone. It is very, very inspiring for all of us. And again, I'll do my best not to cry anymore. What I would like to do now is to introduce both Emily Ware and Althea Hansel to now be live with us and to have questions from the audience to come on and just let us know if you have anything you would like to say to either Emily or Althea. We'd be happy to take your questions. Okay. Hold on one second. Some very nice comments, very well done from the audience, remarkable people. And I do have some questions for you if you don't mind. One of the things that I've always been inspired with from both of you is, in spite of everything that you've both gone through, what are the things that, like from transitioning from, adolescence to teen years to now adulthood, what is it that gives you that inspiration, and has life been different in each one of those stages?
For me, I know that when I was younger, I think, going through what I went through at the time, I didn't grasp like all the things my mom actually did for me during that time, like scheduling my appointments and doing all that. So going into like my teen and adulthood years, actually being able to learn to take that under my own personal rope and do it my own way kind of has been definitely different for me, but I have just kind of learned as I go, and I ask for help when I need it.
Althea?
Well, so I was diagnosed right after I turned 3. I think it was 7 days after I turned 3. And I finished my treatment around the time I turned 4. So I really don't remember anything about my treatment. Maybe like a couple of snapshot memories from the end. But really kind of growing up as an adolescent and then becoming an adult has really been, for me, more of a journey in my survivorship. And gradually as I grew older, understanding what this disease was that I went through, what that means and what it meant for me in my life in terms of the direction that I want to take my life. And so I feel like I spoke a little bit to that in the recorded talk, but it really has kind of motivated me to get involved with research and then ultimately going into medicine myself.
Okay, here's another question. What advice might you give kids who are going through treatment now? And what advice would you give to their parents? Althea, if you want to go, or Emily?
I would say, I mean, for me now, it's been almost 10 years since that time in my life, but I would say, to kids in treatment now, everything you go through will, have a purpose. And I know it's hard right now to see it because you're going through so much. But in the end, I mean, you got to climb a mountain to get there. And I definitely have faith in all kids with neuroblastoma that, I feel like for me during that time, my mom always said, God only gives you what you can handle. And so I really, just looked for inspiration like in that time with survivor stories or just talking. My mom would talk to other parents, or I would hang out with other kids in my, oncology unit. So during those times, you look to your faith and, you'll get through it.
Another question for both of you. Are there any things that you would like healthcare professionals to know where you think maybe they didn't cover information well enough for you? Is there something? I know because, and again, because you were both of you were pretty young. Is there anything you would like healthcare professionals to know about your treatment and your path? I mean, go ahead, Althea.
I mean, I don't really remember anything about my treatment, so I can't really speak specifically to that. But I know that within medicine, there's sometimes a lot of lack of awareness around disabilities and how that affects people's daily lives, and that's something that I've been struggling with most recently with classes in medical school. And so as far as I know, a lot of neuroblastoma survivors tend to have long-term disabilities as a result of the treatment. And so, I'm just always hopeful that the medical field as a whole will become better educated and more aware of disabilities.
Do you have anything, Emily? No.
Mine, I would say, is more so, I mean, like, one of the things I would love to know and like maybe have more research on, like, I know from my treatment, one of my long-term side effects that I really struggle with now is chronic fatigue. I'm always tired, and I worked with my doctors on that for a while, and we can't really pinpoint exactly, what is the root of that, but that's something that I would, like to know because it's really big impact on my daily life.
Mhm. Do you, like when you meet new people, do you ever tell them about yourself, or do you kind of keep that kind of information quiet, or do they ask you any questions? Say from a physical standpoint, do they, say, oh, why do you have this, or why are you shorter, or whatever? Do you talk about it to other people, or do you kind of keep quiet?
I say for me anyways, like my freshman year of high school, a lot of people noticed that I was shorter than most. And if they asked me about it, then I would kind of explain my situation and why I was shorter than everyone else. But for the most part, I kind of keep it to myself because I want people to know me outside of my, cancer patient life, and I want people to know me for me.
Mhm. Right, right. Althea?
Yeah, for me, I feel like it's something I'm very open about. It's not like something that I often bring up in conversation, but I mean, growing up in elementary school and early school, all the time I'd be asked, what are those big things on your ears? Because I have hearing aids in both of my ears, and
Right.
I would explain it, and then kids being kids, I'd be like, oh, okay, and then just like move on to the next thing. Um,
Right.
but yeah, now I generally don't talk about it unless it like kind of comes up.
Right.
Um, and I did see a question, someone asking about normalizing scars from surgery.
Right.
And so this actually reminded me of that question, because for our physical exam practice in medical school, we do it on each other, on the other students. And so
Yeah.
for the abdominal exam, we're taught to, observe the abdomen, look for any scars that might indicate past surgical history. And so, of course, when we were doing that unit, I have a big giant scar on my left side from my surgery. And, it is part of my story, I feel like, having that scar and having that physical reminder of what I went through, even though I don't remember it.
Right. Well, we had a picture one time at our conference where all the survivors were laying in a circle at the swimming pool, and so everybody, and then all of a sudden you just see everybody's scar all over the place, and that's who they are. That's exactly what life is for everybody. Another question that came up is, if you have siblings, do you think your siblings need specific support during your treatment process? And if they did get this, what type of support was most helpful?
Yeah, I have a twin sister. And I'm very close to her. And I was very close to her when I was young. And I know that my treatment was really, really hard on her. I don't think I fully understand the impact that had on her. I know that she had to get help for it for a little bit when we were young. But I don't know much beyond that. But I know that it's really, really important to support the siblings, both because of the direct fear of what's going on with their sibling, but then also maybe the parents are like very focused on the other child and have as much time to spend with them. It feels like their entire world is changing around them. So I feel like it is really important to make sure that they're getting the support they need too.
Right. Yeah, because everybody is affected. Everybody is affected by this. So let's see, we have a couple more here. We've got a lot of questions. Let's see. One of the questions that had come up before is, do you go to late effects clinic? Do you set up your own appointments? How often do you go? Do your mom and dad get involved, or are you the ones who are setting all that up, or? Mm,
Well, for me, I have a lot of things going on with long-term side effects. So I go to quite a few doctors. I think I have like 9 different specialists for different issues, and I see them all pretty regularly. So um, I usually have a couple of appointments a month, and my mom goes with me, or um, I mean, if she can't go with me, then someone will take me, like, grandparents or whoever. But yeah, my mom definitely gets involved. I still, I'm actually within the last couple years have kind of started scheduling my own appointments now that I'm, older, and I had to schedule it around school and stuff like that. But yeah, I definitely have a lot of long-term specialists.
yeah. Now, do you find any issue with some of the doctors? Are you now like in doctors' offices that are, that are not oncology related? Do they understand what you've been through?
It's difficult. I am in some of like, because I'm still at a children's hospital and most of the clinics are there, but I do have some that are not in the children's hospital anymore. So, actually, just recently I have to go to a liver specialist, and so, um, they it takes them a while to find me someone outside of the hospital with my medical history, and so they did end up finding someone who my oncologist is familiar with. But yeah, it's definitely hard, like going to some of my other appointments where they don't know my history, and then they ask you to explain it, and it's really it can get tough for sure.
Yeah, yeah. Althea, what about you with yours?
Yeah, so I actually feel like I got really lucky. So I moved down here for school uh, last summer, and I had a meeting with one of my advisors, and she was just like, "Tell me about yourself." So I shared my neuroblastoma story, and mentioned not being sure about where to find follow up, and she actually recommended me to go see a friend of hers from her residency, who is she's an adult medicine doctor, but she actually did the pediatric oncology survivorship fellowship at Memorial Sloan Kettering, and so she is now my primary care doctor, and but has this additional training in specifically taking care of adult pediatric cancer survivors. So I don't know how I lucked out to find that, but that she's fantastic.
Right. That's good. That's good. At what point, at what point did you know, Althea, because you were young and didn't go through additional treatment. At what age did you know about your cancer and were able to kind of grasp the impact of it?
I don't really know how to answer that question because I don't remember not knowing about it.
Okay.
And I think kind of gradually over time, as kids age, and I like started to understand, what is cancer, what does this mean, what is mortality, like those sorts of big questions, and kind of understanding the weight of that as I just kind of grew up, then it kind of started to hit me very, very gradually.
Okay. Emily, because you've been through a lot of treatment. So,
So for me, I think, I mean, my memory of it, like so my first 2 times having treatment, I was still fairly young. And so my memory was kind of scattered. I do remember bits and pieces and of that time, but my last time I had cancer, I was 10, and I was just, getting ready to go into the 3rd or 4th grade. So that's that last time was the time that, really sticks out to me and I remember the most. But I have always, even from a young age, knew I had cancer and recognized the impacts of it.
Now, well, obviously, Althea, because you're in medical school. Emily, what about you? Do you keep up with what research is going on? I know you come to our conferences and everything, but you're usually with the kids. You're in the kids' room.
I am. You know me.
Helping out.
Yes. I mean, I don't keep up too much on the research side, but I do hear about, new things that they are doing as far as like my oncologist and things like that. Sometimes will, keep me in the loop a little bit.
Mhm. Do you prefer not knowing any more about it?
I don't think that it's not knowing any more about it. I think what consumes my time the most is, all my long-term side effects. So I'm kind of following a lot of, different things on that versus the treatments, but the newer treatments. But yeah, I don't think it's that I don't want to know more. It's just my time is consumed elsewhere.
Mhm. And obviously, Althea, you're in the midst of it. So, let's see, do we have any more questions? I think just lots of wonderful comments about all of you. Let's see. What about this one? One of the things that one of the moms has written that he's a 5-year-old little boy and he's in remission, and he hates when his mother talks about what's going on, what he's gone through and his late effects. Is there anything that can help him? Do you have any issues like that? Listening to your mom or dad, talking about it all the time?
I noticed with a lot of the survivors at our conference and me as well, my grandma, like for the longest time, we would go to a restaurant or go somewhere, and it's like, this is my granddaughter, Emily, who's had cancer 3 times, and that's how she would kind of bring it out. And for me, that's not what I wanted to be known for. And so, I mean, I'm not uncomfortable talking if they talk about it, but it's not like the thing that I want to be introduced with or,
Right.
be known for.
Right. What about you, Althea?
I'm so sorry, I missed the question.
This one of the moms, her little boy, kind of introduces him or talks about him because of his situation, and maybe they don't want to, they don't want other people to know about it, but mom wants to say it, and talk about it and everything. Should they not? Do you care? Do you not care? As again, through time, as you've gone through this.
Yeah, I mean, so with any pediatric cancer, like the story is also part of the family's story. Like it's not just the kid's story.
Mhm.
And I know for me, I don't recall ever being particularly embarrassed about it, but I can certainly understand why someone might be.
Right.
And again, I mean, I just think it's part of, the family's story too. And, part of the family story to share.
Right. I think we've gotten through quite a bit of the questions. Again, a lot of, wonderful comments about all of you. I would like to thank you both for sharing your stories. I find you both very inspirational and I love you both. And I hope you come back to Chicago very, very soon for our in-person conference whenever that happens. So I would like to thank both of you. And what we would like to do now is to thank thank our supporters for being our partners in this whole thing. I'd like to thank Y-Mabs Pharmaceuticals, United Therapeutics, the Thank Foundation, Sanofi, EUSA Pharma, and GRC World Forums. I would also like to thank our steering committee for their input in helping us to form all the different subjects and topics and speakers and everything. They've done a phenomenal job. I would definitely like to thank Dr. Daniel Morgenstern for hosting and being a gracious host for this symposium, and for also heading up the steering committee for us. And now at this point, I would like to hand this over to Daniel for some closing thoughts. Thank you.
Many thanks, Pat. And I'll just add my thanks to everyone who's worked so hard behind the scenes. With the technology the way it is, it's impossible to actually know who they are, all of the people working away to bring this to you everywhere around the world. But I know that Claire, that Nick, Leona, Pat, all of the people at the hosting site have really done a lot of work to make this work, and it's been a wonderful meeting. So many thanks to them, and many thanks to everyone for joining. And thanks so much also to Emily and Althea for that inspiring session. So it's left to me the tricky job of trying to wrap up 2 days of discussion and many hours of presentation in a few pithy words. And I think ultimately, of course, that's an impossible job. I think I want to acknowledge, of course, that, you know, we've heard a lot about the hurt, the pain, the difficulty, the intensity, the real incredible journey that patients who are treated for high-risk neuroblastoma have to go through. And as I think was just said really, you know, well by our last speakers, how that has a massive impact on the whole family, that really this is a journey that involves not just the individual patient, but really the whole family. And I think it's important that we acknowledge everything that families go through when they're dealing with neuroblastoma. But I really hope this virtual conference has helped you to learn more about the disease and has given you some encouragement that there is a lot of, we've spoken about the large phase 3 studies that are run by the cooperative groups, SciPen, the Children's Oncology Group, to try and improve treatment upfront for high-risk neuroblastoma. We've heard about the research studies that are going on to look at whether there are therapies that we can add at the end of treatment to try and press for relapse disease or refractory disease that's not responded to upfront treatment. And those new treatments that we test in that setting may be ones that in the future we can bring forward to the front line so that we get better control of the disease in the first place. And the other topic, of course, that we were just touching on there with Emily and Althea is that of late effects, and the fact that the treatments we give at the moment are still very intensive and very toxic. And clearly, even when they're successful in getting rid of the disease, can have very significant long-term consequences. And it's important, of course, that we recognize that we address those issues, and that we do everything we can to try and reduce those toxicities in the future. So I hope that everyone's been able to take away something from this meeting. It's been remarkable, I think, in bringing together a global community. The community of oncologists and scientists that work on neuroblastoma is a small one, and we're used to getting together on a global basis every couple of years. The ANR, the Advances in Neuroblastoma meeting. But I think this meeting has been remarkable as the first, but also the global parent community. And as this meeting comes to a close, we're very interested to, of course, hear from you about what you found useful, how you might want to see this taken forward for the future. Whether we try to continue with virtual meetings. Of course, this meeting happened out of fault of circumstances with the COVID pandemic, but is this global conference something that we should try and keep going for the future? We hope, of course, as Pat had mentioned, that it's going to be possible to get back to face-to-face meetings. So there'll be a survey that's sent out by email, because of course, always got to be a good email survey after these meetings, but we're genuinely really interested in getting your feedback to hear what worked, what was good, what we can improve on for the future. So that's all that I have to say. We're going to end now with a really remarkable video collage of patients and families affected by neuroblastoma. And I just want to end by saying thank you so much to everyone for organizing this. Thank you so much to everyone for joining. And wherever you are in the world, good morning, good afternoon, and good night. Thanks so much.